morning, good afternoon, good evening, depending on where you're joining us from. My name is Elias Gbadamosi, and I'm happy to welcome you to another interesting session at the Engage Africa Foundation Festival 2022. Here with me, I have Dr. Joy Aifuobhokhan and Mr. Patterson Siema. And together we'll be exploring the topic, strengthening health advocacy processes in Africa. I'll start by introducing Dr. Joy. Dr. Joy is a medical doctor, content curator, and social media strategist. She's passionate about providing health awareness, demystifying health myths, bridging access to healthcare through health tech, gender equality, and women empowerment. She is also a certified product manager, digital marketer, data analyst, and copywriter. She's been recognized by African Women in Leadership as an emerging leader. And next is Mr. Patterson Siema. Mr. Siema is a policy engagement, advocacy, and communications professional with 20 years of experience, and he has worked in the private, non-governmental organization, government, and multilateral development sectors. He serves as a global advisor to the International Development Research Center, IDRC, on scaling science research and policy for impact. In addition, he is the director of the Policy Engagement and Communications Division of Africa Population and Health Research Center, APHRC. Welcome, Dr. Joy and Mr. Siema.
Thank you so much.
And first, my first question, you both are very experienced advocacy professionals, health advocacy professionals. So my first question is, from your extensive experience working across different countries in Africa, how would you say the policy advocacy and engagement system across Africa has evolved, let's say in the past 10 years? I would like to start with you, Mr. Siema.
Thank you so much. So, yeah, indeed, it's just not the policy advocacy that has evolved. If you look at the African continent, quite a lot has happened in the last 10 years. And one thing that I have noticed to have taken place is that there are passionate grassroots institutions and organizations that are led by Africans and are based in Africa that are taking on the challenge of health advocacy. And they're doing a lot of very good work without a lot of investment in terms of our resources. Of course, there's a need for there to be capacity building and also more investment for these grassroots organizations. But the impact that the grassroots organizations are able to achieve in the last 10 years is quite remarkable. And we should encourage that to continue happening. And like before, when most of the health advocacy was driven by multilateral organizations, the UN agencies, and also development partners, we are seeing a shift where local institutions are now driving the agenda.
Thank you very much. Dr. Joy, over to you, please.
Okay, so when it comes to health advocacy over the years, as every institution we have in Africa and in countries around the world, there has been an evolution, basically from the point of stating the problem statement and basic complaints. So we have seen Africans as citizens move from a place of where they just complain about healthcare, about healthcare delivery, their access to care, equitable services. We have seen them move from a place of just providing problem statements and gradually begin to ask themselves critical questions in how can we solve this problem? Because the problem of health in Nigeria is multifaceted. There's the part of the government, and then there's the part of individual factors. So we have seen individuals move from a place of just complaining about their problems to asking critical questions. So going back to the drawing board and say, okay, the government cannot solve all of our problems, but how can we as individuals begin to deliberately speak about these problems, but not just speak about them from a standpoint of providing solutions. So we see individuals coming together, providing health awareness as individual brands. We have seen coalitions between individuals who come together and say, oh, let's start an organization like Engage Africa, and then let's come together and bring our ideas, our solutions together, and then come up for change. And then we have seen this evolve into profit and non-profit organizations all around the world. And now we see that these individual efforts are now attracting global influence. So companies and institutions outside of Africa, and I said, who are this group of people that are constantly talking about health, or are providing healthcare awareness, or providing research about the problem statement, and then now we are attracting public influence. So it has been a gradual place of just re-evolving and then deciding that we ourselves are solution makers.
Thank you very, very much, Dr. Joy, for that insightful response, very, very insightful response. And from your response, one thing that stands out to me is that people are taking health advocacy into their own hands. They are not waiting for government to provide all of the answers and all of the resources. So my next question also goes to you. From that, drawing from your response, I would also like to know, what do you think are the major impediments to strong health advocacy systems across Africa, let's say, for example, in Nigeria?
Okay, so it's a very long list, and I feel like it's not excessive. Training from factors that we are aware of to factors that we are not even aware of. So from the standpoint, the continent of Africa as a whole, so recent studies still shows that especially sub-Saharan Africa has the worst healthcare system. And then it begs the question of why. I mean, we are more populated than most of these other countries. You would expect that with the more numbers, this will equate, better health advocacy and then better healthcare delivery. But that's the converse, it's the opposite. So the primary problem from the standpoint is the problem of illiteracy. Africa still tails down in education as one of the poorly educated countries, where we have so many people not having as easy as basic education. I'm talking about primary school, nursery school education. And with illiteracy comes the inability to seek for help. And it's as simple as that. It's not any magical thing. It's not the lack of willpower to seek for help. It's simply the inability to seek for help because you are not educated and enlightened to the aspect that you think that if I have a headache, my first point of response is to seek for a doctor. So someone who is clearly illiterate will always go back to the traditional ways. Although they are important, I mean, I will stop at this and say there is a place of traditional medicine, which is important, which can be explored, which can be improved to provide healthcare, just like orthodox medicine. But their first point of contact, because of illiteracy, is to look for a herbal concoction instead of seeking for help. The next part of this is the problem of misconception and myths. So Nigerians and Africans all over the world, they said, the way you said, like, bad news spreads easily. So if there's a success story of health, that would not spread easily. But if there is a downside or someone died after doing a CS or someone had some complications from some medication, that is what is broadly spread across all broad. So we have so much misconception, so much myths, such that it makes it hard to be able to clamor for help when the people you're trying to clamor for are blatantly against what you're clamoring for. So it's easy to offer people health or to educate people when they are receptive to this information you're providing.
True.
But in the place of Africa, because misconceptions and myths are bound for so long, I mean, it's just like a brick wall, like you're pushing out the information and just like, it's just, you can't penetrate these places. And lastly is the problem of funding. For every, that statement that says health is wealth?
True.
I believe that as long as Africa refuses to invest in health, we will remain poor. And the poverty in health is not far-fetched. It's simply because it has the least form of investment. To be able to advocate for health in the capacity that will lead to a trajectory of change, you have to invest hugely in health. I was talking the other day with a couple. I was invited to an event, and then I was discussing about the business of healthcare. Africa does not see healthcare as a business, as a profitable venture that we can bring resources together, impute in it, and then get profit, and at the same time provide health. So until we begin to, a major part of providing healthcare or strengthening health advocacy is investment. Even I as an individual, there's just so much I can do without investment. Imagine if I didn't have a phone and I want to talk on social media. There's already a limitation to how far we done. So these three major factors, I believe, in my opinion, are major roadblocks to strengthening health advocacy in Africa.
Excellent points you've made, Dr. Joy. Now I'll go over to Dr. Siema. I'll ask you the same question, but with a little spin. You've worked with a lot of non-governmental organizations. You've also worked with the United Nations and across different governments in Africa. So I want to ask you from a more government perspective, what are some of those impediments to health advocacy when we are talking about structures, we are talking about government structures?
Yeah, thank you. I think, picking up from where Dr. Joy has left, there is very limited investment in the health sector on the continent. And that creates a lot of many more problems, especially when it comes to government. If you look at, for example, the amount of money that goes to education vis-a-vis the amount of money that goes to healthcare, healthcare receives quite a bit less than other factors in other sectors, including even infrastructure and energy.
Wow.
And yet, health is really where we should actually invest more. And this goes back to the structure of government and decision making within government. So you have the policy development process, the policy uptake, and the policy implementation. And here we have a situation where the health advocacy experts are not involved at all the stages. For example, when government is setting up the policy development space, putting in place, defining what the problem is, so that they can actually generate the kind of knowledge and be able to share with the decision maker. So, for example, the cabinet secretary or the minister wants to make a decision on investment, they do not actually have the right information to actually make that investment. This is now why the health advocacy becomes so important, that we need to be able to generate this evidence and package it in a way that the government actors can then make a decision based on that, because they are processing a lot of information, and there are so many people who are lobbying and advocating for their sectors to be given more resources. So the finance minister will only make those decisions based on how they're well convinced that this will actually transform the country in various ways. And so being able to be at that policy development level, being able to share the right information is very, very critical. But beyond that, we also have the policy uptake, where now we have actually generated the evidence, we've shared that evidence with the government actors and the key decision makers, whether it's at the parliament level or it's at the government level, or now it's at the directorate level. The policy uptake is very important. You need to actually work with the governments and the government decision makers to be able to take these policies into action, and then translate the policy into what I can say practice. And in many cases, you find good policies have been drafted, but they're not followed, for example, with investment of resources for health. But then, even where there is an investment for resources for health, you find that even what I may call the burn rate, the utilization of the resources that are made available are not taken up. So you find that quite a lot of money is sent back to the exchequer at the end of the financial year for the government. That means a lot of activity didn't take place, which means, of course, the healthcare environment stays the way it is, where it is underfunded, and many people are actually not able to access good healthcare. But beyond that, you also need to look at the implementation and the impact. So what are some of the health policies that have been put in place, and what has been the impact? I was looking at, for example, many other African countries that of course, received the COVID-19 vaccines, but majority of the COVID-19 vaccines are still in stores, and yet quite a number of people have actually not been vaccinated. So how do we ensure that policies that we have helped develop, the funding that we have secured, goes actually into impact at the grassroots level, where people now feel they need to access these services? And that is why it becomes so important to also go beyond just working with governments to make available services, but address other challenges, for example, misinformation and disinformation. For example, around COVID-19, we know that many people didn't go to get vaccinated because they felt that vaccines were not good for them. And again, when Dr. said about talked about, for example, the use of African concoctions, many people will resort to actually going to treatment from their traditional healers. Not that they're bad, but because they know that maybe they may get some healing. But we know that some of the challenges people go to the traditional healers can be treated through proper medical health care, for example, cancer. But people know that it's very expensive. So because of poverty, they choose not to go to a health facility that can conclusively address their challenge, but resort to actually going to traditional practitioners who eventually accelerate their illness. And unfortunately, we may end up losing a number of them. Thank you.
Thank you very much, Dr. Siema. From your response and Dr. Joy's response, it appears there's a lot going on when it comes to health advocacy across Africa. And Mr. Siema, I would ask you a follow-up question. And that question is, in your experience, you've worked across, I think, about 13 African countries. Yeah. So from your experience, which countries do you think are doing health policy and advocacy right? Like, which countries are far ahead, and what makes them, what is giving them that edge?
So I think when you look at the policy making landscape on the continent, it varies from region to region. Yes. And country to country. We have reasons as to why certain countries look to be ahead, and some countries are lagging lagging behind. So, for example, if you look at an issue like sexual reproductive health and rights, the Southern Africa community, which is made up of I think 16 African countries in the southern region, are much more advanced. And this is because they are driven by the SADC community. The SADC community created a model law, and then this law was actually implemented at the country level. So that made rights on sexual reproductive health and rights be very easily accessible from the entire continent. And we have seen the gains that has had. We have other countries that have not been able to do that. We have, of course, the East Africa community that is also having similar engagements, trying to develop policies at the regional level and being able to translate that down to the country level. And I know that there are certain activities that are also taking place within ECOWAS. The other reason is that it depends on the ability of a focus leader. So when you have a focus leader who is very critical on transforming the health sector, you see a lot of gains from those leaders. And we have examples of some leaders who have actually just immersed their efforts to try and help and address some of the health challenges. And we've seen progress in countries, for example, like Botswana. And we've also seen progress in countries like Rwanda, and we've seen progress in countries like Kenya. The other reality is that it depends on the financial ability of a country. A number of countries are really lagging behind because even though they mean well, they want to put into place right policies, and the civil society is very active advocating for certain policies, but you realize that they're actually facing a lot of challenges. For example, if you look at countries like Somalia, countries like South Sudan, you find that they do not have the resources to actually be able to put this in place. However, that said, we also have countries like DRC, which has been in conflict for a long time, in the eastern part at least, but has been able to actually put in place policies that have actually been more advanced than countries that are very stable. So it really depends on one country to the other. So if you look at DRC, for example, it's one of those countries that domesticated the Maputo Protocol and successfully did so and put it into the national legislation. And that is something that has actually protected the well-being of women and girls in there. However, we can tell that DRC itself doesn't really still have the financial resources that some of the most advanced countries on the continent have, and they haven't actually been able to use their money to actually address some of the challenges that they have. Thank you.
I think from your response, one thing that stands out to me is that it's not only about the resources, it's also about the willpower and the capacity to do these things. Thank you very much, Mr. Siema. And Dr. Joy, I find your profile very interesting. You are a medical doctor, a content curator, a digital marketer, a social media strategist. And I'm like, these things, like, that's a very, very interesting combination. And my next question is, what health advocacy projects have you worked on recently that you find very, very interesting to work on or very innovative to work on? What was the project about, and what are some of the insights that you gleaned from that project?
Right, thank you very much. So, well, at the top of my head, I think that was last month, I got to volunteer with an organization known as the 100K Club. And basically what they are around is providing health, access to healthcare in certain areas of Nigeria. So we did what we call the mosquito drive in the trenches. So we literally went to a garage. That's what it's called in Nigeria. So there are these motor parks where vehicles are repaired. It's called a garage in the center of Lagos. And we literally brought healthcare services to them in the garage. So it went from screening for malaria, getting tested for malaria, providing medications for those who tested positive, free healthcare awareness, health consultations, BP and hypertension and diabetes screening. And I felt like what stood out for me at that point was we know the prevalence of malaria. I mean, once in 30 seconds, someone somewhere in Africa dies of malaria, but you will be astonished that the regular individual is unaware of all of the statistics, which is my major concern about health advocacy. Most times people wonder, why are you always talking? Just let us be it. Okay, we know there are problems. Some people are totally unaware about the problem. And the easiest way to solve a problem is to continue to speak about the problem and to say it all over and all over again. So you'll be, my key shock was that some people were just not concerned. And we're trying to explain to them that, that's what we're trying to do. See the prevalence of malaria. You have, on the 5 children, and you should bring them out and get tested. And they were just lackadaisical towards it, just not interested. These services were free. Obviously, they were paid for by sponsors and other organizations we got to collaborate with. But the major thing that stood out for me and why I became even more passionate about it was the part of providing that healthcare awareness. It's a major issue in Nigeria, and until we continue to speak about these issues, we will not provide solutions for them. Another part was a prostate cancer screen we know that generally in Africa and Nigeria, when it comes to healthcare and seeking for health, is mostly, females will wake up every morning and it's easier for females to seek for medical attention and medical health. But when it comes to male, I do not understand. It's statistically proven, actually. I thought it was a myth. I personally actually thought it was a myth that women are more drawn to seek for help until I actually did the research about it. And so the idea was to offer free screening for prostate cancer to men. And it was literally gymnastic. Like, we were literally fighting to explain to these men why it was important to screen at this point in time. And the general thing was, it's for older people, it's for older men. I'm still in my 20s, I'm still in my 30s, until we began to show them the statistics to show that, okay, if you have a family history of this disease, you're more likely to have it. If you have a distant uncle, somebody that had it, it's definitely in your bloodline somewhere. And then even explaining things as basic as the importance of routine screening, that routine screening is putting you one step ahead of the disease. So why not just check now? It's better you know it's not there or it's there now and be on the safe side. So all of these opportunities at health advocacy just continues to reiterate the background problem, the foundational problem we have of providing healthcare education, and then even strengthens my drive to continue to push for health advocacy.
Well done, Dr. Joy, on the good work that you are doing. And to stay slightly with you for a bit, my next question to you is, when you were talking, you said research has shown that women are more likely to seek health than men. What are some of the compelling reasons why women are more?
Well, I think it's more of how people are built reason. So boys and men are brought up to feel you are a man, so you have to be able to take care of yourself. They are providers. Society tells a man from birth that it's your responsibility to be strong, to have, everything together and not to be weak. Or the converse, women are not brought up to be weak, but they are brought up to see that they, when there's need for, they are caregivers. Ideally, a little child I mean, a girl at age 2, age 3 will be the one carrying her baby sister, trying to help her mom clean in the house and all of this. So there's this part of them that is built to always want to give care and then seek for help in a way. Another part of it is that there's the problem which even affects women in seeking for help, which is the economic strata and the economic difference. So, I mean, it has been proven that even up until now, men are more financially stable than women because of a number of reasons. So, because, I am not financially well predisposed, I don't have the money to treat a disease when it's at stage 4. So why don't I just go to the hospital now that I can seek for help? And also there are definitely more organizations who are female-based. There are more non-governmental organizations who are more prone to offer services for free to women. And there's just this general empathy towards the female gender than the male gender. So it just makes it easy for them to seek for help as at when they feel they need it.
Say men need empathy as well.
They do. These are the conversations that we're trying to have. And I mean, this itself is another myth that we have to try, a misconception that we have to demystify, that seeking for help is not a sign of weakness. It doesn't make you less masculine. If in fact it makes you more intellectually sound as a male to be able to seek for help.
Thank you very much, Dr. Joy. And Mr. Siema, when Dr. Joy was speaking, she made mention of something around statistics, like knowing the numbers. So my question to you is, what is the place of data and statistics, especially since you work with an organization like APHRC? What's the place of data and statistics when it comes to health policy and health advocacy?
Yeah, thank you so much. And I think I agree with Dr. Joy. We actually call them Daktari in East Africa. There is no way you can actually address the health policy issues without farming it in evidence. So the role of generation of data to be able to influence and inform decision-making is very, very important. And this is important because according to the WHO, only about 1.1% of research evidence on health is produced in Africa by Africans.
Wow. So
you, as a decision maker, you're making a decision based on very limited information. And that is something that is really troubling for us as a research organization. And that is why we insist on actually generating more research so that we can actually make relevant research available to the decision makers so that they can make the right decisions. And what we have seen is that when you actually go to a decision maker with the right research evidence, the decision makers are able to make the right decisions, and they're able to actually take your evidence and convert it into policies. We still have challenges in terms of evidence generation is a very expensive activity. You need a lot of money to be able to actually carry out good research. And also the available resources only still come from the West. So we still need African governments, African philanthropies to actually invest more into African health research. That said, the little research that we've been able to produce has really been able to point us as a continent into a direction that tells us there's a problem here, please address that problem. And one is that over the time, we knew that the challenges that face Africa will include things like HIV and AIDS, malaria, dysentery, and over time, when we've carried out research, you say actually the biggest burden to hospital now at about more than 50% is new non-communicable diseases. So people are actually going to hospital and staying longer in hospitals because they have cancer. People are visiting many, many times to the hospitals because they have diabetes. People are actually struggling with their health because they have blood pressure. And this is only able to come out because we are able to analyze the data of who is going to the hospital and who's staying there longer. So now we are telling government there's a problem. Let us find a way through which we just do not just focus on addressing malaria. Yes, it's a big issue, but there's a much more bigger issue. And we saw this come up during the COVID-19 pandemic, that those people who had other diseases, other underlying conditions, were the ones that are most affected. And so if you're going to provide a healthy continent, you need to be able to start looking at what are the causes of cancer. And I like the way Dr. Joy has mentioned issues about cervical cancer and the health-seeking behavior of men and boys. So how do we start sensitizing them to say, look here, you may survive malaria, but if you get cancer and you don't get treatment, you will actually go down with the finances of your country, or your country and your family, because cancer is very expensive to treat. And also now sensitizing governments. If you look at countries like from East Africa, at least I'm much more aware, the number of people flying into India to get medical treatment on some of these non-communicable diseases in India is so high. So what is that doing to our economy? It's actually draining the economy of resources that could actually have been invested. But to do that, you need actually to train more doctors. So how do we then advocate for more specialized doctors to be trained on the continent, and also to ensure that as we continue looking at the non-communicable diseases, we also make sure that there is a very good system of data sharing within government, so that people can actually identify if there is an emerging problem that can actually then be programmed for in terms of health response. Thank you.
I'm very happy, Mr. Siema, that you did mention non-communicable diseases and the growing challenge that non-communicable diseases have become for Africa. And that's like the major focus of Engage Africa Foundation. Our major focus is on increasing knowledge and awareness about non-communicable diseases. And I have another question for you as a follow-up question now. It's that with HIV and AIDS, I think the advocacy around HIV and AIDS is strong. I think, I'm not an expert like you and Dr. Joy, but I think the advocacy around HIV and AIDS is very strong. What are some of the methods or strategies or things that made the advocacy of communicable diseases strong? And is there a way for us to adopt and adapt those methods and strategies to also strengthen advocacy around non-communicable diseases?
I think you're very right. And when we had HIV and AIDS come up in the early 80s on the continent, there was a lot of stigma that was associated with the disease. And it created fear, and it also created very difficult for people to actually go to seek healthcare. Over time, there was a shift in terms of how advocacy was carried out, and said, HIV and AIDS is not a death sentence for you. That there are ways through which you can actually be managed. And there were individuals that could then come up and speak and say, I have survived the last 20, 25 years with this disease and I'm thriving. And we saw children through the prevention of mother-to-child transmission being able to say, this child was born with a mother who was HIV positive, but look, the child is innocent and they're actually thriving, and they will actually be successful in future. So in the same spirit, we need to be able to communicate, for example, issues around cancer. I was at one of the biggest referral hospitals in the country in Kenya, and we have this cancer research program that is going on there. And one of the biggest frustrations that the professor in charge, the health professor in charge of the research, was that while they can treat some forms of cancer at the center, people come when it's a bit too late. And when people come, they almost believe that they're actually going to die. So the issue is that we have communicated so much about someone who died of cancer, and yet the reality is that this person came when the cancer was at stage 4 or beyond. Wow. And that means that the rate of success is very low. So what health advocates like ourselves need to do is to advocate and for people to actually test early. Look for some of these cancers much more earlier. When you actually identify cancer in stage 1 and stage 2, the chances of succeeding in treating that cancer are so high. And this is what the doctor at Moi Referral Hospital was saying, that they have treated so many people and so many people are thriving, but nobody's looking at those people who actually have healed of the cancer. They're only concentrating on the ones that actually came when it was too late. And to address that, we need to do a lot more communication and advocacy among the communities and at all levels, using the various channels of communications we have.
Thank you very much for those very insightful point, Mr. Siema. Dr. Joy, I remember when you were answering one of the questions previously, you did talk about cultural and traditional practices. And my question to you is there a way for us to channel that kind of cultural knowledge and traditional knowledge to building strong advocacy systems for health?
Okay, so how do I put this? So when it comes to health advocacy, we must realize that there are already existing structures that foster whatever information exists in health.
True.
To provide solutions or to even build health advocacy, it must be an interlock between these two existing systems. If we are going to provide health advocacy by championing for health and orthodox medicine and normal treatment forms, we will not do it separate from the already existing structure. And I feel like that's an important part that most African institutions have to understand. So you hear an organization and then they come up and it's a lot of energy and they're literally just trying to push for what they want to offer. And then neglecting that there are already existing structures here that there's already a trust system. I think that's the best description. There's already a trust system for what people know. So if we are going to succeed at this, we must go back to the grassroots and then begin to talk about these societal and religious constructs that have built a trust system in people. And it's very simple. Why do people believe that, why would a pregnant woman wake up and then go to the church when she wants to give birth instead, or go to the mosque when she wants to give birth, or one traditional house instead of going to the hospital? It's because there has been a trust system that has been built over the years. She saw her grandmother do it, her grandmother did it, her mother did it, her sister did it, and well, maybe for some reason they were successful. So she is prone to go by what she is used to. So if we're going to succeed at coming up and say, we want you to go for antenatal, we want you to go and see a doctor, it has to be going back to this grassroots and telling them, okay, I understand that this is what you're used to. Calling the traditional leaders, that's the beginning of all of this. Community entry, call the traditional leaders, call the religious leaders, tell them, we appreciate what you're doing. We see how you're helping your people give access to health, helping your people treat diseases, and we love all of what you're doing. However, we believe that because the world has evolved, there are better ways to go about this. We show them what they are doing and how it's affecting their health. And then with our intellect of medicine and the working of drugs and treatments, we then explain how certain cases of death, certain cases of morbidity and mortality has occurred because of the absence of orthodox medicine. And we tell them, not taking away your herbal concussions from you, we're telling you is a better way to do it. Why don't we join forces together and do it? So we're not taking them away from their religious or societal beliefs. We're telling them it's a merge of these two systems together. And then the focus is patient-centered care. I feel like we miss that a lot when we are clamoring for health and health advocacy. So you see that we are talking about health and demystifying health, and then we forget who we are trying to provide this health. It's the patient-centered care, universal health. That's what we are clamoring for. So if we're going to succeed at this, we're going to tell them that, okay, even inside this, your religion, okay, your religion says you should do this. Let me show you a better way you can even do this in your religion. That way, we are gradually imputing these ideas, these health tips, demystifying their myths. And when they begin, it's simple. When people begin to experience better health outcome, you won't tell them to come to the hospital. True. You'll come them.
True.
If someone had a sister who had, let's say, preeclampsia or almost died giving birth, and she's taken to the hospital and she successfully gives birth, her siblings will come to the hospital. They might not come in the break of day, but they'll sneak and hide and come to the hospital and say, doctor, please, they will come. So our success stories will be formed when we begin to merge forces with the already existing structure.
Excellent point, Dr. Joy. So you're saying we have to build trust in health systems before patients can come into those facilities and seek healthcare when they need to. Mr. Siema, my question to you is, I know this is something that you're passionate about health advocacy and healthcare. And I think in 2019, I interviewed you as well in 2019, and we talked about the importance of having Africans drive health policy and health advocacy. But I would like you to reiterate those points, the points that you made in the interview. I'd like for you to reiterate those points here. Why is it important for Africans and African governments, African policymakers to be at the forefront of advocating for better healthcare systems across Africa?
Yeah, so thank you so much. I think maybe just I can pick up from where Dr. Joy has just left in terms of sometimes when you're working with people choose to go to areas where they trust and for healthcare solutions. And we have, as Africans, we know where people would naturally want to go. So they will go to the midwife when they want to give birth. So as an African, what then do you do to drive that health advocacy? So I know of research cases where institutions and governments have actually trained the midwives on how to identify some of the challenges and when the life of the mother and the child are in danger, and quickly become the referral point to the healthcare facility that is nearest. And that has saved many women. And this is because someone who understands the African context was able to identify the midwives not as the enemy of healthcare, but a pathway through which you can actually use that to get the mother and the child better healthcare. I know a situation where we have, and this is around cancer again, where many people would go to traditional healers. And so an institution somewhere in Eastern Africa was under government. They were able to actually train a number of traditional healers and tell them, when you see these signs, when you see someone is bleeding without being able to address that, and you should be able to actually refer him to the nearest health facility. And they also linked them up with an ambulance where they could actually call the ambulance to the traditional healer's home. And so it actually demonstrates that there is opportunity through which you can actually collaborate with existing traditional systems, but empower the traditional practitioners with modern tools and technologies and ability to now refer them further to for better healthcare. And this includes, in terms of capacity building and training, includes about, for example, if they're using certain kind of tools, how to sanitize some of those tools, because we know that our people are definitely still going to go to them. And this is because, as Dr. Joy has said, the great-grandfather went there, the grandfather went there, the mother, and now the child also wants to go there. So it's important that we actually look at these health advocacy issues from an African perspective, and then realize who are supposed to be our allies and who are supposed to be, for example, people that we can work closely with so that we can actually address some of the health challenges. So in terms of actually taking it further, I would want to say that most of the policies that have been put up on the African continent have actually been, what I can say, donor-driven, top-down. And we need to now start looking at, and this is because maybe there was money that was available, and so government signed to these documents because they wanted to receive the funding that was tied to the policies. And that's why you find that some of these policies then cannot be effective because they were not broad-based. They did not include the challenges of different communities, different countries, and even the logistical capability of some of these policies being implemented. So it's important that our governments, our civil society, our communities be involved in the policy formulation so that they can actually design policies that are in sync with their cultural practices, they're in sync with their way of life, they're in sync with their ability to pay. When you come up with innovations, for example, we've seen on the continent, some of the critical innovations where governments have really spent so much money will include like getting equipment from some of the top companies across the world. But this equipment cost billions of shillings. How about if African countries came together and said, instead of spending $2 billion as an African continent, can we invest in innovations that are African driven, innovations that are sensitive to our weather conditions? When COVID started, we saw that we could not even get a vaccine because we did not have the cold room capability that some of the good vaccines had. So how about we start looking at these things differently and saying, we have African researchers, we have African scientists, we have African entrepreneurs. How do we empower them to actually be players on the African continent, so that they can develop solutions that are not as expensive as what we have seen before, and that can be maintained within our geographical capabilities and also the climate conditions that we have, so that we're just not mirroring what is happening in the West, but we are developing unique solutions that are actually focused on our people.
Excellent. You're already answering my next question. But before I come to you, I'll go to Dr. Joy first. So Dr. Joy, when you were responding to one of the questions about the impediments to strong health advocacy systems across Africa, one of the things you did mention was capacity building. What are some other things that we need in Africa and across African countries to be able to strengthen our health advocacy systems besides capacity building?
Okay, so for, the first thing we need to do is that we need to portray health advocacy as a responsibility of everybody. So there's a general ideology that, okay, and up until recently, individuals will not complain about the healthcare system. What you see them complaining about is the independent factors that make up health. So they complain about doctors, they complain about nurses, they complain about lab attendants, oh, where's my results? Doctor did not attend to me, but they do not see the holistic picture that these healthcare professionals work in a dysfunctional system. And that going to affect the health they are able to offer. So if we are going to strengthen healthcare advocacy, we must realize that it's the responsibility of everyone to advocate for health. So from the mothers, the daughters, the fathers, the teenagers, everybody, it becomes a responsibility to clamor for health. The next part of it is that we must understand that there's a part of making laws and then or legislation, and then there's the part of the implementation. The problem of Africa is not that we do not have legislations for health. More than other continents, we have exhaustive documents. If you see our health policies, detailed, long, clearly stated out plans and things that we want to do. However, when it comes to the implementation, that's where the problem starts. So this goodwill that we have put on pen and paper are not implemented. Where health advocacy comes into this is that we begin to become watchdogs to the government and lawmakers. So apart from, okay, we're building capacity, we are clearly telling them in black and white that you promise us good healthcare system. You promise us access to doctors. You promise us access to screening, routine screening investigation, but we are not seeing all of this play out in the grand scheme of things. So we become watchdogs, them telling them that, holding them accountable to their word and then to things they have done. And we cannot hold them accountable if we are unaware of the problem. So there comes the part of research with individuals and then global bodies, our private organizations, is that we have to have our data right. And then there's the problem of there's the paucity of healthcare data. That has happened for years, it is still happening. So when you're even trying to make projections for healthcare advocacy, you need to have facts to bring to the table, but then we do not have that. So there's a part of research that we have to be very deliberate about. It's so difficult when you want to do research. It's a hassle. I spend most of my time trying to even find data than even doing the actual, because if you're going to present statistics to foreign bodies, they want to see your data in black and white, because that's how you make projections in civilized countries. You tell them this is the problem, this is the statistics, this is how many people suffering from this disease. We have not had the census in Nigeria where I live in how many years? 6, 7? So how do you even advocate for health when you do not know the numbers? And then the last part about healthcare advocacy is the media. I have a friend who says, if you want to conquer the world, you will use the media. And I feel when it comes to health advocacy, it's still largely underutilized. Because these myths and misconceptions have moved from word of mouth, they are now all over social media. So we have people who have completely no idea about health, nothing at all, just coming on there and giving health advice, giving health tips, pushing out medications, putting out drugs. And because we have a poor legislative system and regulatory body, no one is stopping them. So anyone who feels like it can just go and make a medication and stamp a NAFDAC number on it and put it out on social media, and people are buying it because, I mean, the person has a strong will, the person has good marketing skills, and they can just sell their product and people are buying it. If health advocacy would succeed, we must literally speak fluently the language of social media. We must occupy all of this social media, from Instagram to Facebook to Telegram to TikTok. We must be the ones creating and pushing out healthcare content. So I'm always particular to my colleagues, and I'm telling them, no one is in the position to give healthcare advice more than you. I know you're doing it in your hospital, you're doing it in your consulting room, but the effect and the action is like what we see in the hospital is the iceberg phenomenon. We just see the tip of the iceberg. We see the problem, but the entire lump of it is below, and that's where the action takes place, from the misconception to the wrong information to the wrong medication, then the less presentation. So they come at the end of the disease, and we have to work a miracle. So we have to maximize the social media. We have to keep on pushing at. There's a part of repetition. The more you repeat it, you think it's not happening, you think they're not listening. They are listening. The message is coming all over and over again. Drink water, check your BP, go for routine screening. The more we emphasize all of this, the more we see all of this information. We have to, it's imperative that we occupy the media. And also there's the part of digital health, which is, well, every other sector is gradually transmitting from the Web 2 to Web 3. And part of digital, imagine the part of technology. I mean, fintech is a thing all over the world. Why is digital not that concrete? And we need to, because we saw what happened during COVID. Our hospitals closed down. We were totally exposed that we have no form of structure when it comes to healthcare. So in health advocacy, we must begin to tell ourselves that if the world is moving toward technological solution, health as well has to move toward providing technological solution. It's a responsibility for all of us. Like, you could go on and on and on different things that we can do, but when we begin to see that it's all of our responsibilities, and then pick out these independent factors that will provide solutions, I believe healthcare advocacy is something that is doable, but it's a lot of work, but taking one step at a time, one chalk at a time, and then maximizing where we are already right now, I believe is something that we can do.
Great points. Thank you very much, Dr. Joy. Mr. Siema, anything to add about what we can do to build stronger health advocacy systems?
So I think I like how Dr. Joy has actually ended, that we need to work with various stakeholders. And the media is indeed a very powerful stakeholder that we need to use, but also take advantage of the trends that are happening on the continent. If you look at some of the continent big achievements, like if you look at issues like around ICT, the continent has actually been able to leap several steps that maybe the developed world had to walk through. So we can also re-engineer the health advocacy and health service provision on the continent by moving to areas such as digital health. And that will make it easier for many people to actually access health. But also, as we work with various stakeholders, you need to know who is it that you're working with? What is the role of the patient? What is the role of the government? What is the role of the doctor? And what is the role of the community health workers? And be able to then map up ways through which you can actually engage them on some of the critical health issues on the continent. Once we know how to engage them and we keep them engaged, we're actually going to see much more progress in the near future. So I think for me, as I close, is that we need to be able to mirror back that everything we do on health advocacy should actually consider evidence-informed decision-making, that the decisions we make should be based on evidence, and we should always seek to have an impact. And where we see the impact is working, we need to be able to scale it up quickly so that it can actually be rolled up in other areas that are maybe lacking. And then beyond that, we need to be able to document how we arrived at that impact, and be able to share the knowledge that we have with the rest of the world so that they can actually mirror and see something positive being taking place. Thank you.
Thank you very much, Dr. Joy and Mr. Siema. It's been a pleasure hearing you speak. Your wealth of experience and wealth of knowledge really shines through. And we want to thank you very much for joining us at Engage Africa Foundation Festival 2022. But before we go, I have one final question for you both, and I'll ask Mr. Siema first. What is your vision of a healthy Africa?
For me, I think my vision of a healthy Africa is that people should have their health rights supported within the law, but also practiced, and people should not take so much effort and time or worry so much about wealth or how wealthy they are to be able to seek medical health care. I want to see an Africa that really practices true universal health coverage. And once we achieve that, we can then grow as a continent. Thank you.
Thank you very much. Where can we find you if we want to get in contact with you? Maybe your Twitter handle, your LinkedIn account.
So my Twitter is at PK Siema. That is my that is PK Siema SIEMA. And my other handles are Patterson Siema, just like on the screen. You can check for that on the LinkedIn, Facebook, and all the other social accounts that I can go to at my age. Thank you.
Thank you very much, Mr. Siema. Dr. Joy, over to you. What's your vision of a healthy Africa?
So my vision of a healthy Africa is one in which individuals are knowledgeable enough about their health. They are able to seek for help in the absence of diseases or illnesses. And then they're able to notice a deviation in health and then access healthcare with ease. I don't believe individuals should struggle to access healthcare, and not just access healthcare with ease, are met with an established and effective and efficient system where they can get the they need. And on the other side, healthcare providers are able to provide health with ease, and then are able to provide it equitably to everyone at very, very effective timing. So that, I mean, the goal is universal health. And I believe we can achieve it when people know that there is a problem and then have good health-seeking behaviors. And then these health-seeking behaviors are met by a functional system that is able to meet their need all at the right time.
Thank you very much, Dr. Joy. Same thing. Where can we find you online?
Okay, so on Twitter, I am Joy Aifo. So that's Joy and AIFUO, Joy Aifo. On Instagram, I am Dr. Joy Aifo. And then my health brand is Dr. Panantia. That's where I put out health niche and health related content. Yeah, so that's where I can.
Thank you very much. I really can't thank you enough for everything you have said today, the tips and important insights that you've shared with us. And once again, we appreciate all that you do for healthcare in Africa. And we really, really hope that together with Engage Africa Foundation, with you, Dr. Joy and Mr. Siema, we'll be able to make Africa a more prosperous and more healthy society, or more healthy continent. Thank you very much once again.
Thank you.